tranexamic acid, new medication in our inventory. So we're going to go over a little bit today of the basics of it and how to administer it. To start off with, this is for trauma. All right, so this is for adult patients who have suspected life-threatening internal hemorrhage that we can't stop, which is excluding isolated head injuries or injuries that are greater than 3 hours, which would kind of be a rare case for us. Other note, this is not for pediatric patients, so this is only for adults. So what this does is it promotes the clotting process inside the body through a long chain reaction. But we're going to give this in a bolus over time. All right, so this is not an IV push. This is something we're going to infuse quickly over 10 minutes in an infusion. So we got a little bit of setup again to get ready. So we're going to put this medication down. We're going to go ahead and grab our 10-drop set. This is administered with a 10-drop set. Okay, not a 60. So this is a 10-drop set, a maxi drip set, if that's the terminology you'd like to use. And we'll go ahead and set that to the side. And we're going to put this in a 100 milliliter bag. Now we can use D5W or normal saline for this administration. Whatever you have available that day is just fine. So right now we're going to use our normal saline. So this is a 100 milliliters of normal saline. And we're going to spike our bag just like normal. And again, just like any infusion that we're doing, this is going to be piggybacked into an already patent and working line. So right next to me, I have established an 18 gauge in my patient or better. I've flown my line. I've made sure it's working appropriately, and I'm going to keep it at an open rate at least, unless I'm bolusing my patient, till I get this set up and ready to go. Okay. So I'm going to spike my bag. I'm going to fill the chamber again up to about halfway, and I'm going to go ahead and flush my line. All right, so my line is flushed and the air has run out of it. Before I administer my medication into this bag and create my concentration, I'm going to grab my 1-inch tape again, and I'm going to put on my bag a label, because to the naked eye this just looks like you're giving 100 milliliters of normal saline. So we need to make sure on transfer or for our own benefit we clearly label this. I would put 1 gram of TXA, all right, because that's how much we're going to put in here. So 1 gram of TXA. All right, I'm going to put that back down. So I'm going to grab my 10 cc syringe. The way this TXA comes is 1,000 milligrams or 1 gram in 10 milliliters. Okay? That's the way it's currently packaged. Always make sure to check your concentration before you start pulling out of the vial. All right? So we pop our lid like we normally would. Go ahead and set up our syringe. Clean our top with an alcohol prep if necessary. And we'll go ahead and draw out the entire contents of this vial. Okay, so we've drawn out, our vial is empty. We're going to remove any excess air we have remaining in the syringe. It's not a very viscous solution. It doesn't create a ton of bubbles, so it's a fairly non-volatile solution. All right, we're going to administer it through our med port on the bag we've already labeled. Place that over in our sharps container, and then we're going to slowly agitate our mixture again. All right, remember, our line is shut down. This is not plugged into our patient yet, just so we don't have any mistakes. Okay? So we're going to hang this bag on our pole, and we're going to piggyback it into our already existing and patent line. And I always recommend to double check, make sure your IV is still patent just before you plug this in, okay, or any medication that you're going to infuse. So we're going to plug our line in, suspend reality, and this has gone into our patient now. I will shut down my normal saline drip, and I will open up my TXA. So we are giving this 1 gram bolus over 10 minutes. So that's going to be roughly 100 drops a minute, all right? So now remember, we're using a 10 drop set. So this is going to be a much looser administration. Whereas if we had a 60 drop set, we're able to really fine tune these things, okay? We want to give this entire contents of this bag over 10 minutes. So if you happen to have a patient who's bending their arm a lot, or you have some variations in the drip rate, not overall as concerning as we were talking about earlier with our epi drips or vasopressors that are really going to have some hemodynamic effects on our patients. We just want this bolus just administered slowly over 10 minutes if we can. All right, so 100 drops per minute is the goal. That should lead us right to about 10 minutes. Keep an eye on your patient anytime we're infusing a medication. If you start to have some adverse reactions to it, shut down your line, flush it with your normal saline that's already there. Once this is empty, we've administered our entire contents, close it down, remove it, and then go ahead and keep your normal TKO IV if you need to, or whatever is appropriate for your patient.